First of all, let me say, if you are watching this, it's probably because you had a miscarriage. So I'm really sorry for your loss. And I feel it from the bottom of my heart because unfortunately, I also had a loss. I lost my first child at 40 weeks. I was stillborn at term many years ago, and it was due to a cord accident. So it was really the worst thing that ever happened to me in my life. And it's why I'm so passionate about birth and helping support women have positive experiences through their pregnancies and birth. So there's so many things that we can do with Chinese medicine to help somebody after a miscarriage. So one thing is if there's something off or out of balance inside the woman's body for her to have a miscarriage. So oftentimes if I'm seeing her for the first time after she's had the miscarriage, I'm going to do everything I can to help her heal postpartum. And it really is important that we take the time to acknowledge that you are postpartum. Even if you were 4 weeks or 6 weeks or 12 weeks or 15, whatever it was, you were pregnant and you are not. And so, as many weeks as you were pregnant, I would say that's how many weeks you should wait before you try again. So, some people just want to immediately jump right back into it. And I highly encourage you to take the time to figure out what's not working in your body. And so there's a lot that acupuncture and Chinese medicine can do to help put your body back into balance. So the first thing we're going to do is help you emotionally and physically recover from the loss. It is definitely a mental thing, and it's really sad, and it's okay to cry, and I might even cry with you. It's just it just sucks, and it's just one of those things that you didn't do anything wrong. It just happens, and it happens often, unfortunately. And there's help and there's hope. And so one of the things, part of going through a miscarriage, is grieving it and talking about it, and not just you but your partner. So oftentimes the partners are kind of dismissed, where they might feel unimportant or whatever. They lost a kid too. They might not physically be going through the same things. So it's important to include your partner and to stay connected to the partner and get some kind of help if you need it. There's a lot of books, there's a lot of great books out there on loss. And then caring for yourself by going easy on yourself, not rushing right back to work, giving yourself a little bit of time to let your body heal, to take time to regenerate yourself, and really just being positive. It happened, and it happened for a reason. While you might not know that right now, and you might not ever figure that out, but there is some reason that this is happening. And for me, when I had my loss, it really helped me want to have a baby more than anything. And I put everything else aside to be able to put 100% into me and my body to be able to gestate a child. So sometimes people have to slow down and recognize that you might not be able to be superwoman, to have the 60-hour a week superpower job, to have 2 or 3 kids at home, and to be cooking and like something has to give. You have to make space for a pregnancy, for another child in your family. And if you don't have the time or space, it it's less likely to happen. So I've worked with women having miscarriages where they had a chemical pregnancy, and they just barely missed their period, and they were 5 days pregnant, all the way to sadly, I've supported people at all stages of pregnancy loss. And even a woman I had as a fertility patient, I spent a year or so with her working on her fertility. She got pregnant, and she got to about 24 weeks, and they found out there was something wrong with the child's brain, and she had to terminate at 24 weeks. And so we had to get her through that postpartum period and then go through fertility again, and she was able to conceive, and she has a beautiful little daughter, which is really nice. And that was kind of the icing on her cake, since she already had 2 little boys. So acupuncture and Chinese medicine can help support you when you're going through a miscarriage. And it's really something to consider if you've had multiple miscarriages, like what is happening in your body out of balance, and what could I shift in my lifestyle, my diet, my environment, to create a healthier, happier reproductive environment to be able to have all the babies you want.